being on the routine life and all, it would be helpful for the newer kids.
I think it will be good to have a annual checkup maybe, and that is another thing we were thinking. An annual checkup and annual documentation, so we know how the patient is doing. If somebody is deteriorated very fast, that will make us realize that they may have had many flare-ups.
So how that's kind of a preventive mechanism, like
so preventive action.
One is preventive, the next is consistent database update, where what we discussed.
I think one of the other thing we thought was that every FOP India will maintain the database of all the patients. It's not like a registry at the moment, but it's like a database of just the patient with the problems that they have. And we will document every year how they are progressing. If somebody is doing badly, then it may be time to review and make sure that they get something more than what they are getting. So, and also some of them, their needs will change. They may need more occupational therapy, they may need more of help to do various tasks. So like those FOP aids, that various things that we have. So all those things, changes can be introduced. And if they develop any other problem like lung problems and all, so some kind of preventive actions can be taken. I think that is yearly checkup and follow up on that. So that we can put yearly checkup.
Yeah, actually we have to work on that as declaring as a rare disease and have to be taken up to the government, because recently I read it in somewhere like 4 of the diseases have got a medicine and the government is supporting. So we may have to take this as because it is a costly
disease. It is already in the rare disease.
Already no, but for the funding related from the government.
For funding, that's what I have explained to Mr. Sunil how that works. The drug, once you have the drug which is approved in India, then actually the government will put out the effort to make it made cheaper.
Can you just add something? So I had worked with Sunil and we had kind of prepared this write-up to be sent to the government, because they had this 50 lakh fund or whatever it is for each rare disease. But they will give that fund allocation only if there is a medicine, as you mentioned, doctor. So again, we'll have to revive it, maybe write again, but they are not even willing to record FOP as a rare disease now.
No, FOP is already there as a rare disease.
In their registry, they are taking account of FOP as a rare disease only if there is a medicine, because the moment it goes into the register, then they'll have to allocate the money. So they failed to do that. Even though we gave the document to the ministry, they have still not, in my understanding, they have not still recorded FOP as a rare disease by the health ministry yet. I will write again, there's no problem. But Sunil, to my knowledge, I don't think they have recorded FOP as a rare disease, because the moment... No, the ministry, because the ministry, they associate it with funding. If there is no funding...
There is two different things. It's a rare disease, there is no doubt. It's a rare disease eligible for treatment. If there is no treatment, then they will not put it.
No, if that link is not there, they are not even recognizing it as a rare disease.
The treatment should be available in India for them to put it in that link.
Correct. So as of now, where exactly right now is a rare disease, I don't know. But
so in ICMR, it is recognized as rare disease. Research funding is provided for it under the rare disease.
Oh, in ICMR, okay.
But ICMR is part of Government of India.
Okay, but in the Department of Health, will...
Recorded as a rare disease, but because there is no medicine, there is no specific fund available for it to be treated.
As a rare disease treatment, there will be no fund available.
Right, because the last time that we prepared...
You can try for funds, but for treatment, there is no funding from the government.
Right.
There is no medicine.
See, no, ICMR has just given some 50 lakh or 1 crore to a Bangalore-based group for research. I don't know whether it's Bangalore-based. Somebody has applied for it and got it as rare disease for research, for making some Drosophila model or something like that. They're making a fly model of disease. So the money is allocated for research under the Rare Disease Consortium.
Currently, okay.
Yeah,
okay,
it is. I was
okay, fine.
proving it.
So then I think there was some document that I remember working on.
No, that's for treatment part.
That's for fund allocation. Okay. So my request would be to have more general orthopedicians and pediatric orthopedicians in each region, like each city, each who are aware of this. So the message has to spread,
I
because right now we see CMC Vellore as the focal point for awareness and maximum knowledge in this condition. To this extent, we need to create more all over the country. You know,
I
that's,
think everywhere there is a patient, they can create the doctor, I think.
yeah, we will do that if you tell us what to
Without
do.
the patient, they won't understand anything.
So we'll take the guidelines to the nearby,
That's what I'm
orthopedicians.
suggesting. All of you, when you go to the doctor, educate the doctor. If they are interested, then they will become like that. We do it. I mean, it's not that we are not doing it, we do it.
Because of the number of patients are so less that the typical orthopedician never encounters. So
Mr. Sunil, do you want to put this as one of the goals that you will create awareness programs all over the country, or maybe in the media, maybe in the YouTube videos,
and some more.
Orthopedics and
rheumatology,
pediatrics.
orthopedics, pediatric surgery, and rheumatologists.
I would just like to mention in Brazil, the FOP organization in Brazil has worked very hard for past many years, and they have gone up to the president, and now it is mandatory in Brazil that any child which is born has to be checked if its toes are bent. If toes are bent, then they are immediately referred to a pediatric rheumatologist who ascertains, and then the next procedure starts.
But they don't have any outcome data on what is coming out of that.
Brazil is a little closed sort of system. But we should work towards that end, wherein more number of, because the other day madam was discussing, now it is said 1 in a million, earlier it was said 1 in 2 million. So that way our population is 140 crores. So ideally we should have 1,400 patients instead of 65 what we got. And if we have 1,400 or 1,000 plus patients, our leverage with the pharma companies to get the medicine here or research amplifies a lot.
No, we have already been approached by the pharma companies. They do want to come, but I feel we should be ready for what we want to ask before we let them loose. Because if we are not united in how much we are bargaining for, then we won't get it. They'll come and do the study here, and then they'll go and sell the drug there. And or they will make the drug so expensive that nobody can buy it here. So if you're wanting to let the pharma companies loose on your population, you should negotiate that they will provide free treatment, and you should make all the rules, what all they will provide for the patient, and what all special advantages will be given to anybody who is going to participate in their clinical trial. So one of the things you can do is that the person who participates in a clinical trial should get free treatment for life. Things like that, we should put it before we allow them to touch our patients. I think that we should be very careful about how we negotiate. And also we can get them to build the facilities for FOP patients, like installing the machines that are needed for their follow-ups. Everything that right now we are going to raise the money for there, we can get the pharma company to give the money for that.
So currently, whatever is the starting, the contact.
No, we are just actually taking down the points on which to discuss. So this is one thing.
Sure.
Anybody? I think we should keep adding as many points so that we can then start taking them as
Yeah, ma'am, when he was diagnosed with FOP, then we went many places, neurologist, did lots of blood tests, CT scan, everything. But they couldn't find out because the doctors were unaware. Then finally in Mumbai we have Vadia Hospital. Over there we went. He was a very lively, very, very bubbly boy. So there also they did all the tests, but they couldn't find out. Means, जहाँ भी हम लोग जाते थे ना, if he is having a bump on his head, the doctors, they are only examining over here. If he is having a bump over here, they'll examine only on the nape. Finally, they did biopsy, and then too they couldn't recognize. After biopsy, his condition was very worst. Then there was a doctor, Rashid Merchant. He said, okay, let me check. So from head to toe, the moment he went there, he said, yes, it's FOP. So what I could do, I went to Arya Hospital. I told them, okay, whenever you see a child having a bent toe, you please see to it, it is FOP. So like that, I went to many doctors, I went to many hospitals. जहाँ जहाँ तक मैं जा सकती थी, I told them कि you see to it कि हम लोग उसको गलत नहीं करें, don't do biopsy and all. And ma'am, one more thing, I am giving him homeopathy medicine. My brother is a homeopathy doctor. So there is a very good doctor in Thane, Maharashtra. I went to him. He said there is no darkness. So ma'am, after his biopsy, he was having bumps, those flare-ups. But as soon as we started homeopathy, now I can't see flare-ups. So I think we can try homeopathy if possible.
Yeah, I like to add, I'm not sure whether, I don't doubt, but whether that homeopathy drug is a steroid. I mean, I'm just...
You know why he's giving him medicine? Like he's saying, कि we can stop the bones to, bones बनने से हम रोक सकते हैं. We can stop that. So I am giving him that too along with it. So what I have noticed, those flare-ups, they have totally stopped. I have noticed that as per my experience.
So usually before 10 years, the incidence of flare-up, or in fact even the start of FOP is very little. Hardly anybody will start. Most likely your flare-ups initially were either just trauma or surgery. They could have stopped spontaneously. It's like if you have two people, if you give Montelukast throughout the time, and the other child we don't give anything, up to 12, 13, 14 years of age, whether I give it or not, neither of the two children may have a problem. Now, one person I will claim it's the Montelukast which did the benefit. Other one will say it is natural history of the disease. So in any disease, we have to know the natural history of the disease before we say that something did well. So that is why when you go to the site, they will tell everything. They will say may be not beneficial or may be beneficial, because they are not 100% sure whether the benefit is because of the natural history or whether it is because of the drug.
So now also, I used to regret this biopsy up to date, like, क्यों किया? But now, I know it starts from here and some or the other thing will come. So the moment
But he's too small. Usually it starts after 10. Your boy is too small yet for it to be. Yeah. So it was a post-trauma, small lesions and things like that. Yeah. 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 But no, I mean, your point was that we should advocate homeopathy. It's difficult for us to advocate homeopathy based on one instance. And in such a small child, because I have a child who I diagnosed at 6 months, child is 8-year-old, still no lesions, no treatment. So it can be like that, but that child is being protected from all harm because we found the child very early. So can't say.
कुछ बोलना चाहेंगे?
I will give some suggestion which the FOP association can follow. कुछ करना चाहते हैं आपको जो FOP के लिए कुछ मदद जो सबके लिए बेनिफिट करे, कुछ ऐसा सजेशन देना चाहते हैं? Just tell his friend. He's the one who needs.
काही सुझाव वगैरे काही देऊ शकतात किंवा हे जे FOP ग्रुप ऑर्गनायझेशन आहे त्याच्यामध्ये तुम्ही काहीतरी मदत करू शकतात असं, या तुम्हाला काहीतरी मदत हवी आहे असं काहीतरी? तुम्हाला मराठी बोलायचे डॉक्टर हवे आहे ऑनलाईन किंवा कन्सल्टेशनसाठी, किंवा हिंदी बोलणारे असेल तर पण चालेल? हिंदी असेल तर पण चालेल. इज ओके विथ बोथ हिंदी अँड मराठी.
Actually, there is a lot of schemes and services available in the government. If you get a national ID card, identification for the people with disability. Even Tamil Nadu government, they give 2,000 rupees per month. Like that, lot of aids and appliances, lot of schemes, even bus, train, concession. Like earlier, 1996 PWD Act, People with Disability Act, there were only 7 conditions like visual impairment, hearing and speech, locomotor, and mental illness, like that. So now, 2016, they redefined lot of this condition and included even dwarfism, blindness also again into 2, blindness, low vision, hearing and speech, dwarfism, intellectual disability, mental illness, autism also, CP, cerebral palsy, muscular dystrophy, like that. Suppose this FOB. Yes, ma'am, that will come. Yes, locomotor is there, but. Okay. Then maybe they can get maybe FOB, or if you get the specific. Okay. So that will be. I thank Madam and also FOB Association to be part of this association, and because I worked in the community health for 31 years, after that under Madam's project also 3 years. Actually, a lot of the comprehensive rehabilitation program in the community health area we developed. There actually in the comprehensive there is 4 aspects. Okay, medical, under the medical they are concentrating on structure and function. So some organization or some personalities, they will only try to correct the deformity, also improve the function by operating or even providing the wheelchair, aids and appliances, wheelchair, tricycle, a lot of appliances like that. And some organization, they are interested in the vocational rehabilitation, like educational institution offering vocational, and psychosocial, psychological rehabilitation, and also the social rehabilitation also is a part of comprehensive rehabilitation. So not many organizations, but I'm happy to see the lot of the expression about the families, the feelings and their involvement with the child and the family. So actually social rehabilitation is so integrating or restoring the family and community relationship. Like that psychological rehabilitation, so restoring the self-confidence, dignity. So Madam told that children, they are only the parents are fearful or children are they are very bold, like that. So this all the aspects, if you include maybe we like a community awareness, we build all these things, no? The comprehensive type of rehabilitation, that will be very fruitful, I feel. So this under the, as Madam told, you can try to get this disability card under locomotor disability.
Mr. Selvakumar, can you work on that?
Okay, Madam. Okay.
How to get it made.
Doctor, we need that certificate. It will be helpful for others when traveling for exams and all.
You can see under what category
Severe
it can be done.
disability certificate is
Okay, even for flight and lot of train, lot of concessions also available. Okay, Madam. Even I mobilized some 80 lakhs in the Vrisha area itself for the income generation, income generation program. But only sometimes some doctors, they will not give the certificates immediately. It's only the district hospital doctors are, they are only giving these certificates. So I organized some camps. One day itself 300 cards like that we organized, facilitated, helped them to get the cards. Same day, the morning they will come and assess, the evening they will get the card like that. So maybe I will, as Madam told, I will just collect the list of the offices. Every district, they have the district rehabilitation center. They also have these facilities. They give you the card, and otherwise we can get the card from the office and go and get the sign from the concerned district hospital doctors, or any specialty also. Even if this locomotor means we can get the certificate from the orthopedic doctors.
I think when he goes to evaluate each person specifically, he can focus on getting a disability card, national disability card for them. That will be very useful, because this one single card can get you everything. You made it for him? Why don't you just check how she, under what disability? You got it under locomotor disability? Any other suggestions which you want done for your that's very good, because he's not 40% actually. Yeah. He's probably be about 5% or something. Huh? No, he doesn't. He will not be more than 5%. Yeah, yeah. I think many people will get 40%. So if they have the card, then it's good for them. Any other suggestions for the group to do, which FOP association can add for the patients thing? If you can think of something, you can give the suggestions, and then we can just see how we'll work on that. I think introductions are over. Should we have break for lunch and then do the examinations?
Lunch, it's almost ready. The only thing that goes to 10 minutes, lunch can start. 10
10 minutes. So we can have some more discussion. I think we did have last year we had that. Mr. Salvakumar is an expert on that because he's a social worker. So then I was thinking, instead of doing for everybody one class, we are hoping that he can make a personal visit with each person in the next 1 year. So then he can work on that as one of the goals. Vocational avenues also he can do. Yeah, I think only people above 16, 17 will be going for that. So it will be only that group he needs to address right now. It will be, yeah. I think so. Sure. I think probably the age group between 16 to 35 or something will require. Some I know are very well employed right now. One chap who was our last patient with everything fused is 35, and he has got a very nice job. Yeah. I asked him to come, but it's too much effort for him to come all the way. He is in, which is a hill station beyond Coimbatore. Kodai. It's too much for him to come from Kodaikanal. Yeah, I think we should get him on a Zoom call. He's actually very gainfully employed, and he's quite, I think must be the oldest one here who is very well employed.
But I'm encouraging my daughter to start a business. Things like that we can think of, so that they can have business, even employers.
Any other suggestion?
Then the mobility devices which you can use for their day-to-day lives, how they can carry on. That today we don't know. Since it's more of us doing our own research and trying to find out. So if there is a region-wise, city-wise database of people who can provide mobility devices.
I think most are available on the Amazon. Last time when we were making the thing, quite a lot of it was. Yeah, and I've got all the booklets, and we got some of the devices also.
Last time,
I brought a lot of devices with me. I think some of it we have to, again the occupational therapist can help you. So basically, it depends on the person. Each person has a different need. So based on what they need, the occupation therapist has to assess and then provide. Then that will work well. Yeah. Also, that requires also the home visit to be able to see what exactly is the issue in the using the various facilities at home, and then assess that and then provide. It might just require, the where they put the light switches, or or you have some Alexa which does everything. Yeah. That's
Like ma'am said, there is one guy in US. He's completely voice enabled his house.
yeah.
Stephen Aisher. So,
I know. I talked to him for a long time.
So everything is voice controlled in his house. He controls his whole house and all his gadgets, equipments, everything by voice.
I think that's why I was thinking that to be able for a therapist to visit the house and to be able to see what all can they not do and why they are not able to do it, and then focus on that will be easier, because sitting here we don't know what they're facing. It's like my saying go and take a wheelchair, and you can't do wheelchair because you're living on a mountain. Then there is no point of that wheelchair.
There are a lot of websites.
I mean, that's why we brought in Mr. Selvakumar. That's what I was saying. The reason why we got him in was that a lot of the needs are things which a therapist can address. And so far, what the problem is, you talk to me, I don't have the time to sort out that kind of issue. I can tell you take this drug or take that drug and do this flare up. But he can concentrate on how to live better, how to manage better.
Giving this as an FOP India suggestion for
Huh? Sorry?
patient.
No, this is
for
for
us to-
FOP India.
Yeah.
Selvakumar is going to work for FOP India.
Yeah, yeah. As you are asking for suggestions on.
Yeah. Correct. We are agreeing with you. We are not disagreeing. Except that teaching it here, I'm thinking that he should actually provide personal solutions.
Yeah, yeah.
Not the group solution, but a personal solution for every patient who needs it.
Yeah, sure. No, I'm almost done. So.
Any other suggestion? We still have some more time. Do you need anything, Azim? Tell us.
One thing last
You
time
give
we
us
had done,
suggestions.
here we have all child patients.
Yeah.
I've been reaching out to a few companies. Sorry. I've been reaching out to a few companies, and probably with Selvakumar sir's help, I want to see if some of the 16, 17, 18-year-old children, two things. One is, if they are graduates, if we can place them anywhere, because COVID has taught us we can work virtually. So give job opportunities to them. That is part one. And if the children want any specific, because my child, after a lot of research, she's found out a lovely school, and in fact we have put this other child also in the same school.
Yeah.
That is very good. We mentioned that it is K21. It's a very nice school, online school, and it is at par, if not better than most of the schools. Except the physical activity, rest all is taken care of there. So if we can provision our children to get the best education, sitting at home, and if they can do a job sitting at home, I think they will feel very wanted, and they will feel that they have achieved something in life.
I think I agree with you. For one thing, I think we should definitely go for that. But we should not, I think if those who can go to school, they should go to school, because there's no other way you develop that social contact and ability to deal with the society than having to work with your peers, live with your peers and make friends among them. Because you can't do that online. It's not, you can, I think, but not in the same way.
What we have done, other than the online school gets over at around 1:30. Then afterwards, they have different vocational, they go to karate class or whatever, cricket, go to play and go to art. And there are a lot of association of homeschooling parents.
Okay.
Every week they make it a point to go to some particular movie, even if they first only check if that particular place is wheelchair friendly. There is a group. I am part of,
Okay.
she's a part of few groups, wherein the families meet together once in a month in a picnic or something, once in a week movie, all that social interaction is there. They have their own friends, online as well as offline. So I think that could also be one of the options which we could look at going forward.
Yeah, I think that is very correct, but I think we should let them choose the thing, whether they want to be online or whether they want to be real in school, because so many children love going to school.
Yeah, they are very strong-minded, so.
Yeah, so we should let them have the option. Those who do not wish to go to school, regular school, then we should come up with the alternatives for them. Again, I think like if you give him some ideas, then he can sort of make the suggestions.
work
Yeah,
with him,
when he sees the needs, when he does the need assessment, then he can suggest that what can be done for the schooling if the child is unable to go to school.
And I've seen that once they study and they want to do something.
Are you
After
right?
15,
Yes,
16,
I've done the
they feel
schooling
that they have
needs.
to be a part of some
Schooling needs for
project
the
or
15,
do
16,
something sitting at home.
Or to
My
assess
daughter loves to
online
fiddle
schooling.
around. She's learning coding and all that. So like that, if they want to learn anything other than the school,
Yeah.
anything
That
which can
is-
vocational training, like you can see,
Vocational.
so that we should be able to provide online or offline, whatever way it
Yeah.
works.
I was thinking of sports. I don't know, we never think about it. All these Para-Olympics and things like that.
Yes.
I mean, there are so many people who love sports. So,
But the issue with that is like, there is a chance of an injury. But there are a lot of games like chess and all that which don't require physical exertion. Chess could be something which is chess or whatever other things.
Actually, I have read like one kid like 9 years old. He's a football player. He
Yeah.
is right in US, but still like their parents are have more courage than maybe our Indian.
that's what I was saying. The children want to do it and the parents are fearful.
I can tell like my brother, okay, you put him in a school, but as a parent, how do they feel so different? Like, but we have to just take it in a positive way. Give them whatever they want, and we have to take wherever they want to go. That's what our plan is. So I just want everyone to be like that. Like, let them socialize and be a normal thing. Let's not put pressure on them or close because my sister-in-law is like that. She's very chill. Like now itself, even if he coughs also, he's 3 months old. Still like he coughs for something. So you move away from that. It's easy for me to say because I'm an aunt of this. But we have to be like my brother is so positive. Like nothing is going to happen. We will bring him as a normal child and we will be okay. That's what we pray to God and it's going to happen. That's what we believe in ourselves.
Rajesh Borkar is dentist.
You want to do the lecture? Lecture also finish? Then the afternoon can be all checkups.
Sir.
Hi, very nice to meet you. You want to finish off your talk now and then after lunch we can do the checkups?
Whichever is convenient,
You can
however
go
you
there.
have planned it.
Otherwise,
It's going to be a short talk.
yeah, you just
Interactive
finish
session.
it off. Yeah, just finish it off.
So we'll finish,
Yeah,
we'll
yeah,
break for
because-
lunch and then we can have the check.
Yeah, yeah. And then post lunch can be all
Yeah,
checkups.
I am glad to introduce Dr. Rajesh Borkar. He's a dentist and he is aware of all the dental protocols which have to be done for FOP patients. In fact, we were lucky enough that my daughter used to eat a lot of sweets when she was a child. So 6 teeth had gone bad, and there is a chance of trauma happening while the dental procedures are being done. But he had a lot of patients. He interacted with a lot of doctors of IFOPA and all that, and then finally, what could usually take 1 week, 2 weeks, he did it for years together, and she's fine now. But he is aware of a lot of protocols, and he will guide us about some of the preventive things which need to be done for kids with FOP on the dental aspects. Dr. Rajesh.
Sure.
Yeah, I will.
He'll get. But my pen drive is in the car.